Man, I just got my bell rung. Dramatic? Maybe. But for those of you that have ever had a concussion, you know exactly what that phrase means. But for those of you that have never had a concussion, think of it this way. You just got hit in the head with such force that your brain actually slammed into your skull. For those of you that love football, imagine this. It is 4th and goal. The quarterback rolls out of the pocket. He wants to throw a pass way downfield, and then bam, he is blindsided by an opposing player with a helmet-leading hit to the head, and that quarterback falls down unconscious. As an NFL fan myself for many, many years, I have personally witnessed this during a football game and on more than one occasion. As a nurse of over 34 years, I've taken care of traumatic brain injury patients. Patients with symptoms ranging from mild memory loss to patients with such severe brain damage that they will require continuous medical care for the rest of their lives. In the article entitled, "What is a Concussion?" found on the protectthebrain.org website, they wrote that football accounts for more than 60% of all concussions in collision sports. In the NFL, concussion reduction must be a top priority to keep players safe and to reduce the long-term effects that can lead to serious and sometimes fatal consequences such as player suicides. A concussion is defined on the Mayo Clinic Sports Medicine website as a traumatic brain injury that affects your brain function. Symptoms of concussions can be subtle and they may not present immediately. Symptoms can last hours, days, weeks, or longer. The most common symptom of a concussion is headache, loss of memory or amnesia, and confusion. Mayo Clinic describes CTE as the term to describe brain degeneration likely from repeated head traumas. Signs and symptoms of CTE have included difficulty thinking, memory loss, aggressiveness, impulsiveness, depression, substance misuse, suicidal behaviors, and motor changes that we would see in patients with Parkinson's or ALS, or known as Lou Gehrig's disease. I have put up a representation of brain degeneration with CTE ranging from stage 1 all the way down to stage 4. According to the Mayo Clinic website, there is no test to specifically diagnose CTE until the time of autopsy. In 2017, the Journal of American Medical Association, or JAMA, published a study where they found CTE in 110 out of 111 brains of deceased NFL players. That is 99%. In 2021, CNN released an extensive timeline in their article entitled NFL Concussion Facts. This timeline begins in 1994 all the way down to June of 2021. It is so extensive that I could not review everything in this speech, but I do want to point out a few key dates. In 1920, the first NFL football game was played, but an official concussion committee was not started until 1994. In 2002, Dr. Bennett Amalu, a forensic pathologist, diagnosed the first case of CTE in former Pittsburgh Steelers center Mike Webster. He found that in his brain during the autopsy. What you will also find in this timeline is that the NFL downplayed and denied the link between concussions and cognitive decline. From 1996 to 2007, there were 1,545 fully documented concussions as reported in an article entitled 12 Years of NFL Concussion Data, released in 2010. Between the years of 2011 and 2020, there were 2,276 fully documented concussions as reported by CNN. Keep in mind, there are a lot of head hits that do not meet the concussion criteria, and those injuries are not entered in the concussion data, which means that concussions are probably underreported. Perhaps the most recognized case of CTE was found in the brain of Aaron Hernandez. In 2017, the New York Times published an article about the rise and fall of Aaron Hernandez, an outstanding player and tight end at the University of Florida, and as an all-star player that was drafted by the New England Patriots. Off the field, Aaron was linked to gang activity, drug use, and was known for his erratic and violent behavior. In 2013, just 10 months after signing a $40 million contract with the Patriots, Aaron was arrested for the murder of his best friend, Odin Lloyd, and sentenced to life in prison. Subsequently, in 2017, Aaron committed suicide in his prison cell. At the time of autopsy, they determined that Aaron had the most severe case of CTE and likened the brain damage to that of a man in his 60s. Later, the family attorney released a statement stating, Aaron had the most severe case of brain damage they had ever seen in someone Aaron's age, which was age 27 at the time of his death. I will briefly summarize the extensive NFL game day concussion diagnosis and management protocol. This is a very thorough protocol, and it can be found directly on the NFL website. The protocol was developed by the NFL Head, Neck, and Spine Committee, and the protocols are reviewed each year to ensure players are receiving the most up-to-date medical consensus and or the identification, diagnosis, and treatment of concussions. The protocol includes a game day checklist that starts the minute the player gets hit in his head. I did enlarge the concussion day checklist. This can also be found directly on the NFL website, but it outlines the algorithm of the concussion from when the player gets hit, and then based on what the player is going through determines which way he will go as far as treatment. This protocol also includes a return to participation protocol that states that the player must be cleared not only by the club physician, but also by an independent neurological physician that is not affiliated with any NFL club. There is also an injury reduction plan that drives behavioral changes, including preseason practices, better performing helmets, and rule changes. Each year, helmets undergo extensive testing and pick one that best reduces impacts to the head. Rule change assessments are made each year after every season once the injury data has been reviewed. After reviewing the NFL protocol, I reached out to the team physician of my home team, the Jacksonville Jaguars, Dr. Kevin Kaplan, and asked for an interview to get his perspective on NFL concussions. And he released a statement to me via my email that I want to read to you right now. The NFL has done a great job establishing standard protocols, which we all follow for the safety of our players in both the long term and short term. While concussions will certainly be a part of the sport, the way we treat and recognize these injuries are the most beneficial part of the NFL protocol. Education on ways the players hit, in addition to changing certain aspects of the game where we see the most concussions, have definitely changed the number of concussions we are seeing. Helmets are another area where research is trying to determine if there are ways to help reduce the rate of concussions. In conclusion, there is a 74-year gap between the very first football game in 1920 and when the first organized concussion committee was created in 1994. We will never know just how many player concussions occurred in those 74 years, but I suspect the numbers would be shocking. The NFL has instituted a comprehensive concussion protocol that does go a long way in improving patient safety now, but the focus on concussion reduction league-wide should have been made a priority much earlier to reduce player concussions and reduce the potential for developing a much more severe brain degeneration that has now been diagnosed as CTE. Thank you.